Today we're going to look at a few simple, practical, and effective acupressure techniques you can apply on a daily basis for some pretty wonderful therapeutic benefits. I originally intended this as a response to readers of my second book who requested additional visual guidance on applying the techniques taught there, but decided to expand on that. So this will be useful for anyone wanting to include acupressure as part of their daily self-care. So if you're completely new to acupressure, you should know that it is the technique of stimulating acupuncture points by hand, most commonly with your fingertips, in very specific ways to achieve specific desired healing and wellness results. While acupressure is somewhat less powerful than acupuncture, it's free, you don't need a license or extensive training, so you can do it for yourself, and if you use it daily or even a few times a week, your results will come pretty close to what you can expect with acupuncture. It will also supplement and support any acupuncture treatments you may be getting and any Qigong practice you might have. There are two main considerations when using acupressure for daily self-care. The first is what acupressure techniques are going to be most useful to you, to your condition, and how do you apply them. That's the focus of today's presentation. Some techniques bring qi to an acupressure point, which are used to gather and build qi. These are commonly called tonification techniques, useful for treating various types of deficiency or low functional energy of any sort. Now, that low energy can manifest as fatigue, lack of enthusiasm, the poor functioning of any organ, sense organ, gland, or other body tissue when that low functioning is caused by an insufficient access to enough energy for it to perform its work properly. Other techniques disperse qi away from a point. These are commonly called sedation techniques, useful when treating a blockage or obstruction or a local excess of qi. Now, that can cause pain, stress, irritability, among many other things, and you'll learn exactly how to apply these tonification and sedation techniques in just a few minutes. The second consideration is which specific points are going to address your needs the best. Now, this is a much bigger topic than tonification and sedation techniques. I'll show you a few useful common points here that have a wide range of applications. But if you're relatively new to acupressure and Chinese medicine, to take the fullest advantage of what you can accomplish with acupressure, I recommend that you consult a book about acupressure point location and selection, so you can accurately find the points you want and choose the ones that are going to best address your needs. While there are many good books available on the subject, I particularly recommend my second book, Chinese Holistic Medicine in Your Daily Life. It teaches you about 100 of the most commonly used acupoints with detailed illustrations and descriptions of each point's functions and uses. Additionally, it includes recommendations for many popular, commonly used Chinese herbal formulas, dietary modifications according to the principles of Chinese dietetics, and 5 Qigong practices, one for each of the 5 elements used in Chinese medical and spiritual philosophy. Finally, it includes a section on point prescriptions for many health conditions. Point prescriptions are related acupoints combined to most effectively treat the targeted health concern. This removes the guesswork for beginners while leaving plenty of room for growth and development as your understanding deepens and you gain more experience. These may be combined synergistically with herbal and Qigong recommendations included in the prescriptions to support and enhance your acupressure self-care, whether you're trying to heal a health problem, improve your wellness in a general way, or even address and resolve an issue in your Taiji or Qigong practice. Now let's take a look at how to perform some common acupressure techniques. The first thing to address is the quality of your touch and whether you'll be using superficial or deep pressure. Now, you always want to touch with the sense of somehow contacting your chi. That can be a little bit tricky at first, but it really does become a lot more obvious with practice over time. To start with, though, you can begin with what is sometimes referred to as using attractive force. While it's true that you can influence your chi without any physical touch, within the context of acupressure, touch is always employed. Here you can see the finger moves over the surface of the skin with no attractive force. Nothing is happening to the skin or subcutaneous tissues. Using attractive force with almost just as light a touch, you can clearly see the skin moving from the finger contact. It requires a touch that has an almost magnetic quality, indicating that you've contacted and connected with your chi, even if you're not yet sensitive enough to feel that contact directly. With just a very light touch, the skin, fascia, and other underlying tissues are engaged. Next, we see attractive force used with deep pressure. You still want to have a sense of contacting your chi with that deep touch. It will be easier to feel initially with a light touch, so work with that as long as you need in order to get clear about it before going on to using deep pressure. A superficial touch will be more tonifying, while a deeper touch is more sedating. This can be confusing for a beginner as it can seem counterintuitive, but if we use an analogy related to water, it should become more clear. Water analogies are commonly used in China to describe some aspects of qi, since they have a few characteristics in common. If you lightly touch the surface of water in a pond, bathtub, or bowl, you'll see that the water gently adheres to your skin and will actually cling to it, rising slightly above the surface of the surrounding water if you lift your hand a very short distance above the surface of the water. I'm sure you know there's nothing magical or mystical about this. It's entirely within the realm of chemistry and physics. But just as water is drawn to your hand with a light touch, qi is similarly drawn to your hand when a light touch is applied. That gathering of qi to a point will tonify the point, strengthening its effects. If you forcefully push your hand into the same water, it will quickly move away from your hand, rippling outwards, perhaps splashing over the side of the tub or bowl. Similarly, a strong pressure from your hand or fingertip will disperse qi away from a point, sedating or weakening its effects. In this analogy, you see how a light, gentle touch can tonify, drawing qi to an area, while a deep, forceful touch can sedate. This superficial touch using attractive force is tonifying, drawing qi to the area or point, just as light touch draws water to an area as just shown. A deep touch using attractive force is sedating, dispersing qi from an area or point. The depth you choose will be combined with one of the following techniques to amplify its tonification or sedation effects. Now let's examine circular hand and finger movements. Generally speaking, qi likes unbroken circular movement. If you do Taiji or Qigong, you're probably already familiar with that idea from those practices. Now, in the context of acupressure, clockwise circles are more tonifying, drawing qi to that point, while counterclockwise circles are more sedating, dispersing qi away from that point. The exception to that rule is if you select points on your abdomen, in which case the circles need to be reversed. In that case, clockwise circles are going to be more sedating, counterclockwise circles will be more tonifying. This technique may be used anywhere in the body, but it might be best suited for large fleshy areas away from tendons and bones. First, we'll select a point on a hand-yang meridian, large intestine 4. It's located in the center of the fleshy area between the thumb and index finger. Using a superficial touch with attractive force, we make clockwise circles to tonify the point. Notice that the circling motion is continuous and unbroken, creating an optimally healthful, smooth, and even flow of qi within your body. Next, using deep pressure, we make counterclockwise circles to sedate the point. These circling techniques are very easy to understand since they're applied in exactly the same way whether on a yin or yang meridian. More about that in just a minute. Most of the time, you'll be selecting points that lay on and are part of specific acupuncture meridians, and those are energy channels that connect to all of your internal organs and other body tissues. The next technique involves directing qi flow with or against the natural flow of the related meridian or channel. Every meridian is either yin or yang. The yin meridians include the heart, pericardium, lung, spleen, liver, and kidneys. The yang meridians include the stomach, gallbladder, large intestine, small intestine, urinary bladder, and the sanjiao, which is sometimes called the triple burner. Now, in Chinese anatomical position, with the hands held palms forward and held above the head in sort of an I surrender position, the yang meridians mainly flow down the back of the body, while the yin meridians mainly flow up the front of the body. In this example, we'll use a point on the spleen meridian, a yin foot meridian with an upward flow of qi. The sixth point on the meridian, spleen 6, is located a hand's width above the tip of the inner ankle, just behind the ridge of the tibia bone. Using a superficial touch, direct the force of the finger pressure upward with the natural flow of qi to tonify the point. Being that it's located right next to the bone, this technique will work a little better than circles. To sedate a point, use deep touch and direct the finger pressure downwards towards the foot against the natural flow of qi. While it may be easier to point the finger in the direction you're moving qi, you can keep your finger perpendicular once you're comfortable sending qi in the direction you intend. Next, we'll select a point between two close tendons on the foot. This is the third point of the liver-foot yin meridian, which also has an upward flow of qi. Here, we'll begin with deep pressure directed against the natural flow of qi to sedate the point. Alternatively, you could choose a superficial touch and direct the pressure upwards with the natural flow of qi to tonify the point. Next, we'll select stomach 36, a point on the stomach meridian, a leg yang meridian with a natural downward flow of qi. Locate the point by placing your index finger below your kneecap. Wrapping your hand around your leg, the point is just below the tip of your little finger, 1 finger's width away from the bone. Starting with a superficial touch, direct the force downward with the natural flow of qi to tonify the point, strengthening its functions. To sedate the point, use deep pressure and direct the force upwards against the natural qi flow. Finally, we'll select a point on the hand on the yang large intestine meridian. This is large intestine 5, 1 point up from large intestine 4 shown earlier. The point is located between two close tendons, similar to liver 3, and so is best suited for the with and against qi flow technique. Here, a light touch with force directed with the natural flow is tonifying. Remember that in Chinese anatomical position, this direction is down the back of the body. Then, using deep touch and directing qi flow towards the fingers against its natural flow, we can sedate the point. Typically, you will select either a tonification or a sedation technique on any point. You do not use tonification and sedation on the same point at the same time unless you want to harmonize it. Harmonization is discussed next. The final option we're going to look at today is harmonization techniques. If you're not sure whether a point needs to be tonified or sedated, it's always fine to harmonize it, which is a balancing treatment rather than emphasizing tonification or sedation. While harmonization might not address your needs as strongly or as quickly as an appropriately selected tonification or sedation technique, you can't hurt yourself, and harmonization is always very beneficial. Once again, selecting liver 3, if we choose a moderate depth, neither superficial nor deep, and direct chi with and against the natural direction of flow evenly in both directions, we harmonize the point. This balances its functions and helps it work in concert with any other points selected in your self-care treatment. Here we apply the same technique on stomach 36, selecting a moderate depth and evenly directing chi up and down with and against the natural chi flows. You can also harmonize with the circling technique. In that case, you still use a moderate depth and make sure you circle in both clockwise and counterclockwise circles the same number of times in each direction. In this example, 10 circles in each direction are used. Whether on a yang or yin meridian, when harmonizing, the technique is the same, using a moderate depth and even up and down direction of chi. Here we're once again using large intestine 5, a hand yang meridian point. Always engage attractive force, whether using superficial or deep touch, to contact your chi. It may be easiest to learn to contact your chi with a superficial touch, so get comfortable with and clear about just that before progressing to a deep touch. Mastering the easier technique first will give you a foundation on which to grow with over time, and you'll get the best results from your acupressure self-care sessions. Here are examples of superficial and deep touch. Next, try circling techniques with superficial and deep touch. Clockwise circles with a superficial touch is tonifying, drawing chi to the point. Counterclockwise circles with deep pressure is sedating, dispersing chi from a point. In tighter body spaces between tendons, it's easiest to direct chi with and against its natural flow. Here we see deep pressure used against natural chi flow to sedate. Using superficial touch, direct chi with its natural chi flow to tonify. To harmonize, use moderate depth and direct chi equally with and against its natural flow. You can also harmonize using the circling technique. Again, select a moderate depth, moderate pressure, and circle first in one direction for a set number of times, and then circle in the opposite direction for the same number of times. Here again we are using 10 circles in each direction, clockwise and counterclockwise. Whenever using circling techniques, do your best to keep the circling motion smooth, even, and unbroken. I hope you find that this helps you practice acupressure for your self-care. If so, please give it a like and let me know what you think by commenting below. My book supplies a lot more information on this topic, but if you find you'd still like a little bit more than what's offered there or in this video, get back to me and I will do my best to maybe clarify even further in a future video. Thanks very much for watching. I look forward to seeing you the next time.